enjoy the program. Good morning, Dr. Brown.
All right. Good morning. Good morning. I guess good afternoon. It's after 12. So, I think we got it going on here. So I think we're good to go. I think looks like a nice day out there. And so I think we're ready to get this show started. So, all right. So let's get it rocking and rolling here. Okay. All right, everyone. Good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. Sorry about that. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right. So thank you all for joining us, whether you're listening on WVOE, whether or not you're tuning in to the live stream on Facebook or YouTube, whether or not you're watching the recording. We appreciate you watching the recording. And if you are on the live stream or you're watching a recording, like and follow. We really appreciate those likes. We really appreciate those follows. It kind of helps us know what's going on. Leave a comment if you like what we got. Make a suggestion if there's something else you want to listen to. We definitely appreciate that feedback. And for those of you listening on the radio, feel free to call back. Call and let the station know. Let them know it's like, whether or not you like this type of programming, whether or not it's adding value to your life. All those things are very important from our perspective. We want to make sure we're providing you with information that you need. That's going to help you. That's going to help you live a better life. Help you, help your family, help your community. Right. That's our goal out here. All right. So let's get ready for today's show. I think everybody's going to like today's show. Of course, I think everybody's going to like every show, right? That's what we're here for. All right. So today we're going to start part one of a three-part series. And what we're going to talk about today is kidneys. My favorite topic, right? It's going to be kidneys for the next 3 weeks. All right. So we're going to start this three-part series, and it's because March is National Kidney Month. Okay. And I need you to understand something. That is that your kidneys may be small. Matter of fact, the kidneys are the size of your fist. All of your fist, that's approximately the size of a healthy kidney. They're small, but they are powerful. They're quiet. They don't complain early. But when they fail, your life changes forever. Okay. So in the next 3 weeks, we're going to talk about what your kidneys actually do, what chronic kidney disease is, and what happens when those kidneys, as mighty as they are, what happens when they fail. And we're going to have a special talk in that last one where we're going to talk about, genetics and a special gene that has been gaining attention over the last few years called APR1 and why it matters in the African American, the African diaspora community, right? Okay, because awareness without action changes nothing. So let's start out with what is, Dr. Brown, what is National Kidney Month? What are you talking about here? So March is recognized nationally as National Kidney Month, and it was established to raise awareness about kidney disease, encourage early testing, and help people understand their risk factors. Kidney disease affects approximately 1 in every 7 adults in the United States. But there's a problem. So even though it's affecting 1 in every 7 people, most people don't know that they have a problem. They don't know that they have this chronic kidney disease. Okay. And because of this, we want to make sure that, everyone is aware. And that's where National Kidney Month comes in. We want everyone to know what their kidneys do and why their kidneys need to be healthy. And this is why awareness matters. We need to know what chronic kidney disease is. There's also something called World Kidney Day. That's World Kidney Day, and it's observed globally every year on the second Thursday of March. And this is where organizations around the world focus on prevention and access to care. So this kidney issue is not just local. It's not just local. It's not just American. It is a global health issue. So that's something that's there. Okay. And so the question is, this actually gets a little bit on the complicated side, right? Because the question becomes, what do your kidneys do, right? So the kidneys are kind of these little powerhouses, right? And like I said, about the size of your fist. They sit closer to the more of your back, and you have one kidney on each side. Right. And even though they're small, don't let them fool you. The kidneys do so many things. I mean, these are just little powerhouses, they really are. They filter waste from your blood. And which I think is probably something that most people think about. They remove excess fluid, so they create the urine that you pee out, right? They balance sodium, potassium, and a number of other electrolytes, but those are probably the most popular ones. They regulate blood pressure. They activate vitamin D. So, of course, vitamin D is, a sun vitamin. So your body actually makes its own vitamin D kind of in the skin. But the kidneys are very important in activating the vitamin D that's produced by your body. Okay. And it also helps produce red blood cells. They release a hormone that tells your bone marrow to make red blood cells. So, like when the kidneys get weak, that signal doesn't go through. And then they also maintain acid balance. They help to get rid of extra acid. They actually create a substance that helps to balance the acid inside of your blood. So that's another thing that they do. So the kidneys really are powerful organs, and they do so many things. It's a lot of people are like, oh well, it's just a filter. It's a lot more than a filter, right? It's a lot more than a filter. It really does help with a lot of things inside the body. And it's just, it just kind of quietly sits there and it just quietly does its job. Okay. So, your kidneys help control your blood pressure. When your blood pressure is out of control, your kidneys are at risk. And when your kidneys are damaged, your blood pressure becomes hard to control. And this really, so blood pressure and kidneys, the relationship is really tight. So, and it's unfortunate. So, I'm gonna say this again. When your blood pressure gets out of control, it damages the kidney. When the kidneys are damaged, it makes the blood pressure harder to control. So it becomes a cycle where it just kind of cycles through and one really interacts on the other. Okay. And so one of the things that know about the kidney is that there are about 1 million tiny filtering units called nephrons. Okay. And nephrons, so there are 1 million of them in kidney, approximately whenever you're born, and they're called nephrons. They're kind of they're really the working unit of the kidney. So you put all of them together, and it becomes a kidney, and they're kind of special filters here. And what happens is when those nephrons become damaged, depending upon how they get damaged, they may not regenerate. Now, sometimes there's some way they get damaged where they heal themselves, but a lot of these diseases that we talk about, once they damage that nephron, especially once they scar it over, that nephron is damaged, it's gone, and it won't regenerate. And when that happens, that means the rest of those nephrons that are left have to take over that job, and it really kind of stresses them. So that's one of the reasons why prevention is everything. And this is, and in the body, we talk about it with the heart, we talk about it with the brain. Sometimes you get some damage that can recover, but a lot of damage that comes from chronic diseases, unfortunately, when it happens, depending on how it damages that organ, you can't get that tissue back, especially once the scar is over. So prevention means everything. So talked a little bit about, of course, World Kidney Day. We talked a little bit about what the kidneys do. So then we want to talk about who is at risk. Who is at risk for kidney damage, right? So the risk factors for kidney disease. So if you have this, you're going to be at higher risk of developing chronic kidney disease if you have high blood pressure. Okay. If you have diabetes, if you have heart disease, if you have obesity, if you have a family history of kidney failure, and actually, if you have African ancestry. So, in fact, African Americans are 3 to 4 times more likely to develop kidney failure compared to white Americans. And it's not by accident. So, like I said, so, and matter of fact, before we go forward, so higher risk. So as you see here on the screen a little bit, so these are some of the risk factors for having chronic kidney disease. And so you need to be just talking to your primary about this. High blood pressure, if you got that, your kidneys are at risk. Diabetes, if you got diabetes, your kidneys are at risk. Heart disease, because like I said, there's an interaction between the heart and the kidney. And also some of the chronic diseases that affect the heart also affect the kidney. So you're at risk, right? Obesity. So don't get it twisted. Just being obese, there are some conditions that can occur with your kidneys if you have extra weight on board. And of course, that extra weight also drives high blood pressure and diabetes. So it all feeds itself, right? And then a family history of kidney failure, because so when you see that, then you start thinking, maybe there's some genes that are going on, some genes that are not working well. And then, of course, African ancestry, and this is also a little genetic as well. And that's because there's some things we're going to talk about. And like I said, I got a special session and our third show that's going to talk about that. So, but like I said, the disparities that occur with African Americans, it's not always by accident, right? Some of it's access to care, some of it's blood pressure control, some of it's genetic. But what we want you to do, we want you to understand that you can feel fine, okay, and still have kidney disease, okay? Kidney disease is very silent in its early stages, okay? You cannot feel your kidneys when they are decreasing in function. You cannot tell it. I've had people that I'm putting on dialysis, okay? I'm putting people on dialysis and they're telling me they feel fine. And some of them, yeah, I mean, like, they don't have like the swelling, they're doing okay, they eating okay, they feel, but I can look at the labs and they're dangerous lab changes that say, hey, if you don't get on this machine, then like I said, you're risking your life. So just because you can't feel it doesn't mean it's not harming you. Okay, so just remember something: kidney disease is silent, especially in its early stages. So don't let the fact that you don't feel bad lull you into a sense of complacency whenever it comes to the kidneys. Okay. All right. So we talked about that a little bit. So we talked about National Kidney Month. We talked about World Kidney Day. We talked about what the kidneys do. We talked about who is at risk. The people that are at risk. And this section, next section, we want to talk about. We want to talk a little bit about what tests. So what tests should you ask for? Okay. So what tests should you ask for? And that is because why? We just said kidney disease is silent in its early stages. So you have to look for things inside of the blood and inside of the urine that give you an indication that something is going wrong with your kidneys. And there are two main tests that you look for that give you an indication that something is going on with the kidney. Test one is what we call an eGFR. The long name is the estimated glomerular filtration rate. But eGFR is what you'll see if you pull your labs out. You'll see a thing called eGFR, and it's going to have a number beside it. And that number tells us how well the kidneys are doing the job of filtration. Okay, so go to your test. Okay, look at all, give you all that stuff. There's everything. There's sodium, potassium down there. The CB, or hemoglobin on. So, but one of the things you're going to look for is an eGFR. And if you write it down and ask your doc, when you go to see them, they'll tell you where it is. They'll show you how to find that. But eGFR, that number, I tell people to think of it as a kidney number. It tells you how well the kidneys are filtering. And a way to think about this is like this. So, most people have a phone, right? Get your little smartphone. And you'll notice up in the corner, there's a icon, a little thing that looks like a little battery. And, you can turn it into numbers, right? So there'll be numbers and it starts out at 100. And then, use a little bit and it goes down to 90. use a little bit more, drops down to 60. And everybody knows that as that number drops, you have less battery function. Well, the EGFR does the same thing for the kidney. And that's why I tell people to think of it as a kidney number. So that number will start out high. And most of the time, when you're a child, you may not have the number. But like I said, nowadays, most people will get it on their labs. And as it drops, as it decreases, as that number gets smaller, you have less kidney function available. Your kidneys are not functioning as well as they were when that number is higher. So that's what the EGFR does. So that number is going to drop down. Now we use that to use stages. We're going to talk about that next week. But this is what they do. Okay, that's what they do. So number one, EGFR. Number two is a urine albumin test. Albumin, ALBUMIN. So the urine albumin test, and that is a urine test. So what you do with this one, you actually provide you a sample of urine. And the real thing is this is albumin to creatinine ratio. It's actually a ratio, albumin to creatinine. And that number will tell you it's an estimate of whether or not there's early damage. So when there's an abnormality in that ratio, the albumin to creatinine ratio, is looking for this substance called albumin, which is a certain type of protein. That tells you that there's something that may be going on with that kidney. And so it's a real early test. So even if you get like a regular urinalysis, a regular dipstick, this test can tell if something's going on with your kidney before that dipstick. So it's a special test. It is not the same test that you have with a regular urinalysis. You have to do a special test with this one. All right. So EGFR, your kidney number, urine albumin to creatinine ratio, and that is a urine test that checks for early kind of real early damage to the kidney. So those are the two tests. And if you don't walk away with anything else today, walk away with the fact that those are the two tests you should ask for, especially if you are on this list, then you should be asking for these tests. Okay, you're going to ask for that. So that's what we want you to do there. Okay, so we got that going on. So high blood, and like I said, for high blood pressure and diabetes, the recommendation actually is around once a year you should be having this done. Okay. All right. So let's go back over it. I like that. I think with this one, I'm going to try and do a little less content in each show so that we can explain it and go over it. Make sure everybody knows that with these shows, what you need to do and make sure everybody's understanding this. So, as we kind of start off, so what to start out with, Kidney Awareness Month. And that Kidney Awareness Month is to make you aware of what the kidney is, what it does, and to make you aware about chronic kidney disease, so that we can increase the number of people that are getting detected, that are getting treated. Okay, and remember, this disease affects 1 in 7 adults in the United States of America. So if you're in a room and there's 7 people there, one of them probably has chronic kidney disease. And like I said, most people that have it don't know it. That's why awareness matters. When we talk about what the kidneys do, they're little powerhouses about the size of your fist. And the things that they do, they filter waste from the blood, they remove excess fluid, they help balance the electrolytes, especially stuff like sodium and potassium inside the blood. They regulate your blood pressure. They help you to activate vitamin D. They help produce red blood cells, and they maintain acid balance. So these are all the jobs of these little quiet powerhouses, right? That's what they do. And who's at risk? We talked about that one as well. So like I said, if you are now this is not an exhaustive list, so there's a lot more things that can go on, but this is a majority of it right here. So if you are on that list, then you're at risk of developing kidney disease. So that means you need extra attention to your kidneys. Personally, everybody needs to pay attention to kidneys, but these people especially need to pay attention to their kidneys. All right, and just remember, kidney disease has no problems. Early kidney disease has no symptoms. It could be percolating for just fine, right? So we're gonna do this one more time. If you're on this list, remember, early kidney disease. It has no symptoms. It is very silent. So you need to make sure that you're getting these tests. Make sure that your primary is getting these tests. You can ask for it. EGFR. Find out what your EGFR is. Find out what your kidney number is, and follow that kidney number. So as your kidney number decreases, you need to know why is it decreasing. All right, that's one of the things you want to make sure you know. And then of course the urine albumin, which is the urine albumin to creatinine ratio. You want to make sure you check that, because honestly, a normal kidney, they shouldn't be able to really detect much of anything. So if they start detecting it, there needs to be an explanation, and you can always ask. And if you have questions, say, hey, I need to be referred to a kidney doctor. See if they can evaluate and see what's happening to your kidneys. But I want you to make sure you remember that. All right, so we kind of put it out there, then we went over it again, because I really want people to make sure that they understand this piece, right? So, all right, and okay, so in terms of protecting those kidneys, I mean, this is kind of an early, really an early thing that we're talking about. Because we're going to talk about some more information next week. So things that are helpful for the kidneys. And yet again, I always have to put that disclaimer out there that I'm a doctor, not you're a doctor. So make sure you go to your doctor to get specific health advice. But in general, these are things that we typically tell folks to help protect their kidneys. So one is control the blood pressure. You want to make sure that blood pressure is under control. So make sure they're adhering to the guidelines and getting your blood pressure under control. You want to reduce salt, and looks like nowadays they're thinking maybe refined sugars may be playing a role as well. And so, you want to reduce the salt, and salt and refined sugars. A lot of times those are found in processed foods anyway. So if you go to a whole food, plant predominant diet, you start getting rid of a lot of extra salt anyway. Okay. Manage your diabetes. You want to make sure that diabetes is under control. Work closely with your primary care clinician, your endocrinologist, to make sure that diabetes is getting under control. You want to make sure that you understand. Make sure you understand your diabetes, and then make sure that you're keeping your diabetes under control. Okay. So I know a lot of people, diabetes is a tough one, because of course it involves eating right, and those sweets look good, but those sweets drive your blood sugar crazy, and they really do cause a lot of damage in your body. So I want to make sure that you understand that. And the kidneys are one of those organs that really is sensitive to diabetes. And the worse your diabetes is, the more damage it can control. And the thing about diabetes is that, you could be uncontrolled, like so you're young, it's uncontrolled, and then in your 30s, you get it under control. And sometimes that damage that you did earlier can catch up with you later. That's a whole other conversation, right? Staying hydrated. We always recommend people stay hydrated. Of course, water is best. Every kidney doctor is going to tell you to drink some water. So, but make sure you stay hydrated. And the other one, and this is something that I think a lot of times we, in the clinical world and the patient education world, that we don't really articulate. Keep your appointments. Okay. Keep your appointments. And when you can't make one, call and get it rescheduled. This is how you stay on top of your labs. I've seen people come to me because, they had a primary, something happened, they missed their appointment, and then they, maybe the office tried to call, and then they didn't get it set up, and people forget. Sometimes time goes by very quickly. So, what you might think of is a couple of months, maybe a year. I've seen people think, oh yeah, I seen my doc, a couple of months ago, and come find out it's 2 years. Okay. So make sure you keep those appointments, keep them in your schedule. And, even if you have to, reschedule what you rescheduled, make sure you keep it there. It serves as a reminder for you to keep your appointments. So blood pressure control, reduce your salt, manage your diabetes, stay hydrated, and keep those appointments. Okay. We want to make sure that we're protecting that. Right. So as we kind of wrap up here, one of the things we want you to do, so I guess some call to action. You want to make sure that you do things. You want to make sure that you know your numbers, and we want you to encourage someone else to get tested. So if you know somebody that fits that category and they haven't gotten tested, tell them, hey, make sure you go check out your kidneys. Especially if they're on that list, make sure they're getting their kidneys checked out. So, for this week, I'm gonna make sure you find out what your blood pressure is. Ask your doctor for your kidney numbers. Encourage someone in your family to get tested. If you need to, like I said, PressureMD Academy is here for education and to help you however you want to. So like and follow, and feel free to send us a message if you got questions. Of course, this is for education part. Like I say, and again, I always have to put that little disclaimer in there that this talk, all these talks, are for education and entertainment purposes only. If you need specific medical advice, then always reach out to your clinician or sign up for an appointment. You can do that too, but you can do those things. But and also, if you have any symptoms, anything emergent, call 911 and make sure they get you to the hospital, as quickly as needs to. So next week we're going to talk about chronic kidney disease, what the stages mean, and tips for helping to stop progression. Because one thing, by the time we finish these 3 sessions, is I want you to understand that your kidneys are silent, but you don't have to be. All right. So thank you for tuning in. I really appreciate everybody that tuned in either on WVOE, those that tuned in on the live streams, Facebook, YouTube. We really appreciate that you're tuning in. Just make sure you like and follow, and look forward to seeing you again next Wednesday. So we'll be doing this again next Wednesday and kind of going from there. All right. Thanks a lot. I greatly appreciate it.
Thank you.
All right. Take care. Bye.
And this is WVOE 1590 AM in Chambers, North Carolina. And